So March 8, 2002 was an important day. That's when we told the world there is light at the end of the tunnel. Cancer may not be a death verdict any longer, an automatic death verdict any longer. Let's remember this date for a moment, March 8, 2002. December 15, 2007, the New York Times, on its title page, published an article, "Reversing Trend, Big Drop is Seen in Breast Cancer." 15% drop in breast cancer in the US from August 2002 to December 2003, which was the latest data they could collect. Rates of the most common form of breast cancer dropped a startling 15% from August 2002 to December 2003, researchers reported yesterday, based on recent reports by the National Cancer Institute on the incidence of cancer. Now, they started to speculate, what could it be? One guy said, well, maybe the women in the United States took less estrogen during that time, because there was a study out that discouraged the use of estrogen. I had another idea. I remembered the date of our publication, March 2002. So I went to the statistical board in the US and inquired about the sales of green tea in the US. And while green tea sales in the US were stagnant 2001 to 2002, in March here was the publication, it increased 34% from 2002 to 2003. Remember, this was about the period they were checking. And here were the latest data, December 2003, from the cancer statistics. I will be closely monitoring what these years will show with respect to the decline of breast cancer and other cancer forms in the US. I'm not saying at this point we are sure about this. I'm a scientist, but this is the only scientific explanation that I have for this dramatic decrease. 15%, we are talking about thousands, tens of thousands of women. September 2005, now, you remember it was not just green tea. The combination we tested was lysine, vitamin C, polyphenols from green tea. The other component of this composition, vitamin C, was shown to selectively kill cancer cells, not by some remote scientist, but by the largest leading research institution in the world, which is the United States National Institutes of Health. That's a research city, 80,000 employees. They published this report, not anywhere, but in the official proceedings of the National Academy of Sciences in the US. Title, I repeat this just so that you're not missing something. Vitamin C selectively kills cancer cells. Selectively means they left the healthy cells intact. Kills means destroys. Vitamin C means Not toxic chemotherapy, but a penny substance. Someone comes to you and says there's no evidence about the role of vitamins in preventing or blocking cancer. You can relax and sit back. Let me show you something. If you don't have it available, you can download this information from our website or from the NIH. This picture summarizes where we stand. Remember the beginning of this talk? For thousands of years there was a belief, and it was wrong. Discoveries, a new understanding, turned this belief around. And this is exactly where we are today with respect to cancer. People have been dying from cancer like flies. There were certain steps. Vitamins are discovered. The use of vitamin C in the fight against cancer was tried for the first time, so on and so forth. But it took two things: bringing this information together, financing independent research to prove it, and saying it loudly to increase, to build up the pressure that these leading research institutions had to publish this. Or do you think they did this voluntarily? They had to. They had to. But we say, we don't care. Great that you did it. The more the better. But we have to understand the time we are living in. And that is, for the first time in medical history, we have the possibility to control cancer naturally. Not in all cases. If we meet in 10 years, in 20 years, there will still be cancer patients. But I dare to predict that in 20 years, cancer will no longer be the number 2 cause of death in London. And who made this possible? Who finances our research? The answer is very simple. The people we have helped. All of them, they're probably as skeptical as you are tonight. Good. That's what we want you to be. But if you decide to test it, if you're a patient, if you want to do it because you want to improve your health, general well-being, if you have a loved one who is being helped, then we expect you to do something. You don't have to come back to Dr. Rath and say thank you. But spread the information. Talk to others about it. That's the only way we can break the silence. Will it be easy? Of course not. Will you be fought for telling the truth? Of course. Will you be asked, if you are right, why don't we read it in the BMJ or see it on BBC? Of course.